Hey nurses, let's dive into lupus, a complex autoimmune disease that is often tested on board exams. But first, let's quickly define what autoimmune means. An autoimmune disease occurs when the body's immune system mistakenly attacks its own healthy tissues, thinking that they're foreign invaders. Now, let's talk about lupus. It's a chronic autoimmune disease that can affect multiple systems in the body, including the skin, joints, kidneys, and more. One of the hallmark signs of lupus is that butterfly rash, also known as malar rash. It's a red, butterfly shape across the cheeks and nose. Lupus can cause a wide range of symptoms, including joint pain, fatigue, fever, and kidney problems. Patients may experience photosensitivity, hair loss, and even oral ulcers. When it comes to lab findings, patients with lupus may present with a positive ANA, also known as anti-nuclear antibody test, which is sensitive but not specific indicator of the disease. Other lab findings may include a positive anti-dsDNA or anti-SM antibody test, low complement levels such as C3 and C4, and kidney damage indicated by either proteinuria or hematuria. Treatment for lupus typically involves medications like NSAIDs, corticosteroids, and immunosuppressants. The goal is to manage symptoms, prevent the flare-ups, and minimize the organ damage. Patient education is crucial. Teach patients to avoid triggers like sunlight, stress, and certain medications. Encourage them to adhere to their medication regimen and to attend regular follow-ups. That's a quick review of lupus. Want to learn more and ace your board exams? Head over to thecohenreview.com for additional study resources and expert guidance. Thank you for watching.